And we can be pretty quick with this one now that you guys kind of have the flow of how we approach this. Start with the question itself: what's most likely for the patient responsible for the patient's edema? I'm still a proponent. Honestly, I'm still a proponent of just taking a quick glance at those answer choices. We're dealing with those Starling forces in this case. You have capillary hydrostatic pressure, capillary oncotic pressure, and lymphatic drainage. And then variations on that kind of thing, decreased, increased. And so that's kind of the gist of what we're focusing on is what's going on intravascularly as it relates to fluid. 54-year-old presents with lower extremity swelling. And now it's taking an interesting turn as urine has an uncharacteristic frothy appearance recently. And so when you hear that, you really should start thinking about proteinuria. That's kind of the test writer's way of communicating to you proteinuria. He has a past medical history of hypertension and type 2 diabetes, but it seems like he isn't on any therapy for that. And so when you're thinking about proteinuria, I think that on some level, both of these things are not, the kidney does not like both of these things, but especially would not like type 2 diabetes in the context of when you start losing protein. Afebrile, he's hypertensive, which we know from his past medical history. He's pulse is normal, respirations are normal. And then he has 3+ pitting edema up to his knees bilaterally, as well as periorbital swelling. And then urinalysis reveals 4+ proteinuria and fatty casts without ketones. Serum glucose is 248. So kind of in the constellation of all that, this patient is presenting with a syndrome. He has a collection of problems, a collection of signs and symptoms. And so if anyone has any thoughts about what that might represent, feel free to drop that in the chat. Complete blood count is normal. And so which of the following, coming back to the question, which of the following for this patient's edema? So great. So people are already chiming in. Diabetic nephropathy, nephrotic syndrome. Perfect. So this is nephrotic syndrome, presumably related to his diabetes. Losing a lot of protein. Think about protein as that substance in your blood that helps hold on to fluid, helps pull fluid into the intravascular space. It's osmotically active. And so, you're constantly having this equilibrium of fluid leaving your arteries and veins, the capillary beds really, and coming back in. And so the blood pressure that you have pushes fluid out, the oncotic pressure, and to some degree, the tissue hydrostatic pressure pushes fluid back in. If you don't have that intravascular protein content, you lose that osmotic gradient. You lose that ability to pull fluid back into the capillary beds. And so, I think I might have been kind of circling around the answer and maybe giving it away. I'll turn it over to you guys and let you chime in what you might think it might be. Great. So everyone is perfect. So you have a decrease in that capillary oncotic pressure as a result of decreased protein content and then decreased ability to pull fluid back in. Quickly going through the other answer choices: decreased capillary hydrostatic pressure. You'd expect this more in like a hypotensive kind of process. Decreased lymphatic drainage. This would occur in the setting of if for whatever reason you have scarring of lymph nodes. If you had, for example, in the derm world, we often talk about sentinel lymph node biopsies for patients who have melanoma. And so that might be something, if you want to get really kind of out there, Wucheria-Bancrofty. So kind of strange diagnoses that might cause lymphedema. That would be what you're referring to with C. And then you're not having increased capillary hydrostatic pressure. That also would cause edema, but that would happen for a different reason, not for the oncotic pressure, the protein losing information, the protein losing process that's happening in the kidney. And then you're not having increased oncotic pressure for the reasons we discussed, and hydraulic conductance is a little bit of a distractor here. Alec, anything else you want to add for this?
No, I think that was great. People jumped right on it, caught right onto that type 2 diabetes that's been untreated for, however long. And the likelihood of that resulting in nephrotic syndrome. Love it.